Thanks for your patience. So nice to meet all of you. And you really all span the gamut of my work in that I intersect with so many of you, but in completely different ways in some ways. And I'm going to ambitiously try to present a talk in which I try to kind of link some of these worlds as they have been linked in my own work. So we'll see if I can come anywhere close to effectively doing that in roughly 30 minutes is what you were hoping for, I think. In order to accommodate the time, I tried to cut down on some of my social networking stuff and focus a little bit more on the digital divide. And given the balance of the room, I'm not sure that was the right choice, but happy to always talk about anything that I mentioned here. If there's not enough detail or you want to follow up, we can always do that at another time. So let me just, so that I can see my notes, make this screen a bit small. Okay, perfect. So I'm going to set a timer to try to keep myself on track because I have been known to be long-winded. I typically present myself or try to synthesize my elevator speech by saying that my work really tries to answer kind of two key areas or two kind of questions. One is, how do people connect with digital technology, specifically people from marginalized groups typically? So how do they find social support, build social capital? Many of the questions that many of you are also interested in. And then out of that work became interested then in the question of disconnection, right? So given all of these potential benefits that we know are available to us, what happens if we then can't connect? What I'm not going to talk about, which I thought might be interesting to some people in this room actually, is more recent, very policy-centric work that I've become interested in. And so right now I'm analyzing data from a content analysis of all bills submitted to Congress, so both passed and non-passed legislation that in any way intersects with digital equity or the digital divide, and kind of content analyzing those through a lens of various digital divide theory and kind of Van Dijk's resources appropriation model, to try to see what predicts passage and also party affiliation of the sponsor. So this is work that I'm super excited about, but not going to talk about. Instead, I am going to try and briefly present one study that kind of situates that first body of work that really looks at kind of strategic communication for building capital and building social capital and social support networks. And then I'll spend a bit more time on the digital divide, a digital divide study. So this first study, again, I was going to try and do kind of a high-level overview, so interrupt me if you have a question. But it came out of work that I was doing when I was living in Philadelphia. Philadelphia is a highly racially and ethnically segregated city. So this is data from the US Census. It's a bit dated, but you can see here the blue dots are African Americans, yellow dots are Latinos, green dots are whites, red dots are Asians, and slightly more integrated into the city, but otherwise a pretty racially and ethnically segregated city. And after having collected some data, some diary data in the city, came across research from Gustavo Mesh. I don't know if any of you are familiar with his work. He has this idea of social diversification, and he's tested this concept in Israel, also a very racially, ethnically segregated part of the world, and kind of put forth this idea that the internet can be and will be used strategically by marginalized groups, specifically marginalized racial and ethnic groups that have been geographically segregated away from resources. And so, in other words, the internet becomes kind of this compensatory tool, right, for building capital and building networks. So, of course, in Philadelphia, you can see that this is the case. And indeed, if you map on the racial and ethnic segregation onto kind of socioeconomic segregation within Philadelphia, you can see here that the lightest green census tracts are those that are lowest income. And you can see this, sadly, but not surprising, almost perfect match between kind of the wealthier suburbs and the very low income north central Philadelphia that maps onto kind of racial and ethnic segregation as well, right? And so again, I had actually collected diary data for a slightly different purpose, but realized that I had this data that allowed me to test this same question of social diversification, this use of the internet to kind of broaden one's network to try to get outside of these segregated areas of poverty with this sample. And so I had a sample of over 2,000 social interactions, diary data. About 15% of those interactions were some sort of mediated interaction. And when I collected the data, I had paid people $90 to participate in this week-long study. Again, what I kind of pulled out was a little bit of the details of the method. So if someone's interested, I'm happy to talk about using Palm Pilots to collect diary data. The last, I don't know, 20 Palm Pilots on Earth, I think. And so people answered random surveys over the course of the day for 7 days. And we ended up with a sample that was what the racially and ethnically relatively diverse compared to certainly most student samples, and also had some diversity in education. That was another IV of interest, where we'd see the same patterns by education. And then the outcomes here, in this case, my measure of whether or not people were kind of diversifying in as the hypothesis proposes, was whether or not they had a weak tie communication versus a kind of strong tie communication, and then also whether or not they had interracial communication, and as another signal of kind of diversifying, right? And so what then the hypothesis would predict is that the disadvantaged groups, in this case, African Americans and Latinos, and the reasons I have, just to be clear, because Asians are socioeconomically a very diverse population within the US, but there's some pretty good research that says that Asians that are college educated in the US tend to have kind of wealth and socioeconomic status that looks much more like whites. And that was relatively true in our sample to the degree that we could tell. So that's why they're in the more advantaged group in this particular study. So compared to whites and Asians, African Americans and Latinos in this sample should be seeing much more diversity in their interactions when they're communicating over technology compared to in person, whereas you really shouldn't see that necessarily in the more advantaged samples, the argument being they don't need to compensate, right? Because they have the resources within their network, and so they don't need to use the internet in this compensatory way. So just to give you, again, kind of a brush over the findings, the key findings, that is indeed what I found, that the odds of having a weak tie interaction online were much higher for these disadvantaged groups than they were offline. And you see very little, basically no difference when it comes to kind of how advantaged groups communicate online and offline, at least to the degree that they were having weak tie interactions in those spaces. And then I also, as I said, looked at interracial interaction. I didn't see an effect for education there, but I did see a similar effect by race. And so indeed found that racially, ethnically disadvantaged groups, African Americans and Latinos here, were having at least what they perceive to be more interracial interactions online, right? You don't always know, but they're kind of guessing online compared to offline. And you see a little bit of the opposite with the whites and Asians. So the reason that I like to pair this work actually is because not only does it give people a kind of general perspective of who I am as a scholar, but because to me, what this tells us, again, is if we know that, especially for marginalized groups, the internet can be this really critical tool for building network, accessing social capital, to me, that just creates even more urgency around the idea that then people need to have access, right? We need to ensure that people have the technology available. And indeed, that is actually very much how I came to kind of my digital divide scholarship. So I'll now kind of talk a little bit about some study, or kind of a few studies, but specifically one study and a field experiment where I've dug into this idea of technology maintenance and kind of disconnection over time. This work actually started for me where I was doing another kind of intervention-like study, trying to see if I could put people in group texts in public housing in New York City, where I was living at the time, and randomly assign people either to be in these group texts or not, just to kind of be these assigned groups that would meet in person, to see if I could build kind of community network, social capital within these kind of economically deprived areas. But I went in advance and wanted to do qualitative interviews with participants just to get a sense of how they were already using their phones and whether or not this seemed feasible. And in the process of doing that, came across conversations like this one. So again, we were asking them, do you use your phone for communicating with your neighbors or, connecting with friends? And Carla said, yeah, I miss it when I don't have minutes and I can't afford to buy them. Today I put $10 on one of them. So she had two different phones and was bouncing back and forth. The other one turns on the 13th. So she had a government phone that kind of came on after, re-upped after she'd run out of minutes. And then at the end of the month, it would re-up. She says, yeah, I feel naked. I feel like, wow, gee, I need to talk to somebody. There's nobody, And when I don't have my phone on, I talk to my cat Rambo. So this study then led into subsequent studies where I decided to kind of explicitly target this question of repeated disconnection, which was really, again, the beauty of qualitative work, right? Really kind of like emerged from these interviews. Was not something we were looking at. And at the time I was being funded by the Robert Wood Johnson Foundation. I was really interested and still continue to be interested in health outcomes. And so did a subsequent study where I asked people, in Indiana at that time then where I was living, how does access to technology and maybe disrupted access to technology affect access to healthcare? Well, then of course, what I found there was, although there were serious disruptions, what people were actually most concerned with often was disruption in access to employers. People would say things like, yeah, I don't have minutes all the time on my phone. Employers can't call me as much. They can't get a hold of me. They're going to call someone else to do the job, right? So the participants who are also people who are technology insecure, right, phone insecure, are the same people who are typically working shift work. They're kind of working part-time gigs. They need to be in constant communication with potential jobs or shifts. And if they don't, they miss out on employment, right? People also talked about a lack of social support. One participant said, when my dad passed, the relatives, they're mostly in another state. I couldn't call them, I couldn't talk to them. I really didn't know, and I wasn't happy. I was grieving, and I know they were, and I felt really disconnected and lonely. And this would happen. Barry, in fact, had a daughter who was also cell phone insecure, right? Because people have the same share socioeconomic status within their network. And so by the time his phone came back on, his daughter's phone was off. And often what happens, right, is when people are changing, when they're running out of minutes, especially with respect to disconnection with cell phones, the problem then becomes even maintaining that phone number, right? So often these burner phones just get tossed, you get a new number, makes it even harder to get a hold of you. So not only are you being phoneless for a while, because this population doesn't have landline phones by and large, but then they're constantly changing numbers. So this became of great interest to me, this idea that I then kind of labeled technology maintenance, this continuous work that is actually required to stay connected, kind of became my entry point into digital divide scholarship, with the proposition being that low-income users, of course, are more likely then to have to rely on technology that's broken, it's borrowed, or what I call dependably unstable. It's cycling through these periods of disruption. And that's probably was most evident with people reliant on prepay or government cell phone plans, who are often without minutes. Interestingly, this is less of a problem in California. I've collected data in California. California is one of the few states that has long subsidized unlimited access via Lifeline phones. And so, but in the rest of the country, as Lifeline was rolled out, over the past decade, I think when I started collecting data on Lifeline phones in 2012, only 5 states were giving them out. And at that time, they only had 250 minutes on them. Now that the number of minutes has increased dramatically, the number of states that have adopted them, of course, everyone's got them. And I think now it's 1,000 free minutes. So that gets probably most people pretty far. And again, California and Alaska were the only 2 places where the state was chipping in to kind of just up the plan to make them unlimited. But this happens with computers too. And in fact, subsequent research of mine with surveys of students and low-income populations found this kind of similar poor quality of connection, right? Not just the access, but the quality of access to laptops as well was associated with worse grades, greater stress, lower quality of life. So I've now got this kind of body of either survey work or qualitative work. And then what I wanted to do, what was kind of missing as of a couple of years ago, was trying to demonstrate a causal effect of disruption on some of these outcomes. And so I ended up taking on a field experiment with a sample of very low income, cell phone insecure Indiana residents. And I contacted them. In order to do this longitudinal study, I needed kind of to recruit through their caseworkers, often at either local nonprofits or healthcare clinics, to kind of find people that were stable enough to stay involved through the course of a 9-month study. Not socioeconomically stable or financially stable, but what I mean is like not dealing with severe mental health or addiction problems, which is also quite common in this very low income sample. And then what I did with a very large team of graduate students is collected survey data at baseline, and then 6 months after following a field experiment intervention where we actually, sorry for the awkward like bouncing around of this slide, it's a little bit wonky, but we in the treatment condition gave people stable cell phone access for that 7-month period, or for that 6-month period. And then in the control condition, gave participants the financial equivalent in the form of a grocery store gift card, right? So that any effect wouldn't just simply be to the fact that we were giving them extra money that they had freed up, but it was specifically giving them cell phone service. And the hypothesis then was that participants receiving the monthly cell phone service would show the most improvement in self-reported health and well-being, knowing that access to, their clinic, their caseworkers or their doctors or their friends were, really important for health outcomes, and obviously general well-being. And I can get into the quality of life measures in a minute. But the other factor that we were especially interested in was social support as a moderator of health, because there's a massive body of work, which I've been playing in for a while, on that kind of critical role of social support for health. And, it reduces disease, people have fewer accidents, and we actually live longer, right? If we have greater social support. And I'm sure that that's something that's probably data that's more or less something many of you are already familiar with or might be familiar with. And so obviously these tools, right, are really essential for accessing our support networks. And there's kind of work that suggests that to the degree I would expect this moderating effect, I can imagine that prediction going in either direction, right? So there's work that finds this rich get richer effect, which we're all, those people in the digital divide space are certainly familiar with, right? That maybe, in this case, maybe those who already have the most support benefit the most then from having that cell phone access. Or would we see this poor get richer effect, where those who actually have very little support then use the phone to kind of tap into that limited support they had? So we pose this as then a research question. Will the amount of the emotional support that a person has moderate this relationship, this predicted relationship between having stable access to the cell phone and these health and quality of life outcome measures? So this is kind of just a visual of the study design. I did a survey in advance, which is reported elsewhere, and so we'll kind of ignore that for now. But the key measures that I just described were this SF-12, a very well-validated self-report measure of physical health, and then a WHO kind of overall quality of life measure, and then some measures of social support, which I can get into. Social support is kind of a weird thing to measure, but I tend to rely on Lisa Berkman's measure. Do you have someone in your life that you could turn to if you needed to discuss something very difficult, is kind of one of the key questions. So measure those at baseline, and then every month for that 6-month period, and then at follow up. And if anyone's interested in kind of the methodological logistics of that, we actually ended up writing a paper just on that process. I will say as an aside, obviously this is a very low income and often unstable population, as I mentioned, but people were really committed, not just to having the gift cards, but especially in the phone conditions, so making sure they met with us, right? Because the intervention was also the compensation. We had multiple people have to go to the hospital, one for a car accident, one for another reason, one because she had a baby. And they called us and asked the graduate students working with them to meet with them in person so that they could fill out their surveys and get their monthly phone card. The woman that had just had a baby wanted her phone on so that she could take pictures to share with the rest of her family, right? So my graduate student ended up being one of the first people to see her baby, right? This just is kind of this anecdotal illustration of just how essential these devices really are for a population that can't, it's not presumed that they can afford their regular cell phone bills. So to give you a kind of a demographic overview of the sample, the study took place in Indiana, so it's a largely white sample. It's an older sample. It's not a student sample, right? So the average age was 42. The median income was $11,000 a year. So many of these people didn't actually report hardly any income. I know that seems inconceivable in California. It probably is. In Indiana, you can barely scrape by on $11,000 a year, but it is indeed the median income. It wasn't an error. I've been asked. It's a pretty low educated sample, not surprising. Most people had less than high school or less, although some people had some college. And then I just wanted to kind of draw your eyes to the very bottom of this kind of small text slide. I apologize. And note that only one person in the sample actually had a landline phone. So again, I said most of us actually don't have landline phones anymore across the country, but that percentage has always been higher in the low-income population. So I think almost 70% of low-income are mobile only of low-income residents in the households in the U.S. I think is the actual unit don't have landlines. Sorry. So and needless to say, of course, my point is only that having the phones was their only mode of communication outside of the home often. So to give you then a sense of the data over time, the first slide here is the health, that validated self-reported health measure. And the red lines are those with lowest social support. The green lines are those with highest levels of social support. And as you can see, in general, you see this improvement in self-reported health over time for those in the treatment condition, but that improvement is most steep, right, for those with the lowest social support. And that same pattern then was also borne out across the various subcategories of quality of life. The only one that was not significant, although the trend is in the same direction, was the psychological quality of life measure. But physical health, environmental health, which actually measures things like, do you have access to information? Is your living space safe? And then kind of social environment, social supportive environment. Those all followed that same pattern where not only did people in the treatment condition who had these kind of stable access to phones improve over time, but they did so most when they actually had the least amount of support. So I was so focused on clipping along that I'm actually moving quite quickly, which is great. There'll be extra time for conversation. So from a theoretical perspective, this was a really important study for me to kind of validate and elaborate this technology maintenance construct, specifically filling this gap by demonstrating this causal effect in having stable access to technology as critical for kind of quality of life. And then also, again, further underscores the importance of social support, especially for those who maybe are most lacking. And then this is actually quite consistent with kind of a broader range of scholarship. This kind of ties back to the other study. And for those of you in the room who are interested in kind of how populations and maybe especially marginalized populations use technology to connect, right? That across the board, we find that those who are either kind of socially marginalized because they're insecure or have low self-esteem, or maybe for other reasons, right? Maybe because of their demographic status, they're have a disability or trans or someone who in their offline community maybe have a harder time finding support, right? We know from decades of research that the internet becomes that really critical tool. And so I kind of link that to, again, my digital divide work to kind of better motivate them why we need to make sure that people living at the margins have this stable access. And then from a policy perspective, I think that, you know, this is all kind of different in an after times world, but in the before times, I used to point to the fact that Lifeline was set up to, although we had started offering internet service through Lifeline, the recipients had to choose. You could either use that subsidy to get cell phone service or get internet service, right? And so with this kind of presumption that internet service is perhaps more comprehensive, but to me, these data really point to the need to make sure people can get both of those things, which I think in a post-COVID world, we are all realizing. But also something that I really advocate for out of my own work with respect to Lifeline policy is the need to protect voice minutes. So Lifeline is actually scheduled to drop voice minutes and to switch just to data plans with the presumption, I assume, that they assume clients will just start to use like VOI you know, tools, that they'll just get kind of voice over internet tools, which I think is great, you know, if you're a 25-year-old on Lifeline and you managed to kind of know, you know, the fancy gadgets of the internet. But I think for probably your average Lifeline user, they're gonna really miss out on the same services that they rely on when the phone actually comes with free either unlimited or kind of $1,000 or 1,000 minutes a month of actual voice minutes. So that's kind of my policy push out of this specific study. And I was, again, moving so quickly that I end up with being under 30. So these are an acknowledgement to my collaborators, and otherwise I'll stop there and just open up the space for questions.
Thank you, Amy. It's a fantastic presentation. And we do have a good amount of time for conversation. I have several hands up already. So maybe Key, you can start and then move to Eddie. Key, you had a
No, sorry, I was using the clap
okay.
emoji.
That was a clap. Okay. Okay. Well, let me do the live clap.
My hand is both clapping and right.
Okay, Francois does have a hand up. Go ahead, Francois.
So maybe I'll start. So thank you so much, Amy. This is really wonderful. I love your phrase of dependable and stability, and that kind of resonates with some of the instability we found in doing work with folks who are homeless on Skid Row in LA. One of the questions I have for you is, so you're implying that then technology maintenance is expensive. I'm wondering whether you have any good measurement of how expensive it is. How much more expensive is it for somebody who is in your vulnerable classes to keep their connection? Intuitively, for those of us who don't really have to think about it, we just put it on auto payment and we don't spend any time reconnecting. For people who have to reconnect, it's not just the money and they can get subsidies, but it's also you have to reapply for those firms, for those services, you have to requalify for Lifeline. I mean, so the time you spend is huge, right? So there's an extra cost that's imposed on the people who are disconnected so they can reconnect. Not to mention the cost of switching numbers where people, can't reach you anymore. But even if you just count the cost of re-entering the numbers in your cell phone. So I'm just wondering if you have any good estimation of that or some qualitative data on how expensive it is for people who are disconnected to reconnect.
I love that you asked that, Francois, because actually that was the first thing I thought when I saw this data almost 10 years ago. I started talking to economists that said, how can you help me value this very thing? And, so there's actually an economist working in my department in Indiana. And one thing that he told me was, well, unfortunately, people don't value poor people's time. And so the argument from a cold-hearted economist perspective was, well, they've got lots of time, right? So he was like, that's one hurdle to actually valuing that, which of course is gross and not the reason not to do it. And I talked to another health economist, and long story short, I couldn't seem to get enough traction out of economists to bite to help me, because I don't have the skills to actually perform that. But I can tell you from a qualitative perspective, yeah, I mean, I can only kind of confirm what you're saying and say that, you know, I also had people say things like, I missed out on my, I mean, I can just give you story after story. I missed out on my food stamps because I couldn't re-up because my phone was off for a month. I missed out on my enrollment in my Medicaid. You know, many people talked about missing out on employment opportunities. So I think there, I mean, that was for me for a long time, a really important question, was trying to actually see if I could put a dollar amount on that, right? Because how persuasive is that for policymakers? But I never got that far. If you want to have that conversation, I'd love to try again. But I certainly can provide a wealth of qualitative data that speaks to that kind of in a variety of domains.
Yeah. Well, the first step would be, if you have any data on the time, then you can argue about how much that time is worth.
Right.
And you could say, okay, what if it's $5 an hour? What if it's $20 an hour? You know, and then you value it differently depending on your estimates. But even knowing what is the time bill on maintaining your connection will be very useful. So
absolutely, and I do collect a fair bit of data when I collect survey data, especially on disruption, and I try to actually spend a fair bit of time also asking about repair, right? Who do you turn to get the help? So trying to understand that process, I think, is also important as part of that calculation. How expensive was the repair, but also how much time did it take you? What are your resources that you had to expend in order to get reconnected? Yeah.
Eddie, now you had hands up.
Martha?
Yeah. Dr. Gonzales, thank you for that presentation. Over the summer, and I'm sorry again for the loud noise. Over the summer, I was working with Hernan and Francois, and I still am as an RA for the CETFPU project. But over the summer specifically, we were conducting interviews with some of California's most low-income residents across the state. And we were, in our interviews, we were finding that, you know, folks who are unstably housed, a lot of that research, what we found corroborates exactly what you were presenting. But I was curious, both through the work that you were doing in Indiana and in Philly, were language barriers a role or an issue in accessing policy? I mean, and I say that like thinking about the ways that I was conducting interviews with like monolingual Spanish speakers and things like that. And so my research is really concerned with how non-English speakers can still access these benefits. And I'm wondering how that's come up in your work.
Yeah, and it hasn't a ton because there are not, well, I should say, the non-English speaking population in Indiana is so invisible, right? So there is a growing undocumented population there, but it wasn't, they're even less tapped into services. And because the way that I've historically recruited, especially there, was through the organization. So going to an HIV clinic and a shelter and talking to caseworkers who then put me in touch with their clients. Or rather, right, they give them my number and they let them reach out to me. But so I just haven't encountered, I haven't collected data on non-student samples since I've been at UCSB, because it's only been 3 years. And then one of those was a pandemic. So I was just starting to do community work here, and then the pandemic shut it down. So, because obviously I would come across that here. And of course, yeah, there's lots of evidence to suggest that would be a problem. I can't speak to it in my own work specifically. But I'm happy to talk with you more about it offline if you wanted to like try to brainstorm about ways to kind of take these ideas and use them to inform kind of how to best help a non-English speaking sample or population.
Thank you so much.
Yeah.
Amy, if I may, perhaps taking you in a different perspective on your work, but I find it really fascinating the way you're combining qualitative and quantitative. And it's something that we talk quite a bit about with our students, many of whom are here, but it's one of those much easier to talk about it than to actually do it. But you're doing it. You've I think you've done it very successfully. So I wonder if you can talk about it and talk about the collaborations that this brings, or just give us a sense of what this is. Some of the challenges you've encountered in doing this type of mixed methods research.
Ooh, yeah, that's a big question. I could probably talk for a very long time about that. But I mean, for me, I just find it the most rewarding. When I started doing qualitative work, I was a postdoc through the Robert Wood Johnson Foundation and was working with a bunch of other sociologists and public health scholars, many of whom were qualitative scholars. So I fortunately was surrounded by some really expert people, because I was trained quantitatively, really almost exclusively, but was able to partner with people who kind of ushered me into that world. So I would say that's kind of one bit of advice, is whether you're starting qual and trying to move quant or vice versa, right, is partner with people at the beginning as you move into that other method, logical space, if that's kind of if there's one that's more foreign. But I mean, and then I guess I can at least say probably my technology maintenance work is where I see it the most. I mean, I've done qualitative work on the kind of other half as well, where I've done interviews with trans individuals, crowdfunding to use, for top surgery. So kind of, but in the technology maintenance work, I very much kind of started in that classic way that you would want qualitative work to function, which is, again, kind of doing these interviews to kind of get a lay of the land before I did this field experiment, and then seeing these ideas really very inductively arise, these ideas of technology maintenance. And so then for me, what was very strategic, I guess, if I'm trying to give advice, was to then do subsequent qualitative studies to really flesh out the ideas. And then in a piece that was, I think, published in CR in 2020, although it's been available online for quite a while, for me, the next step was to try to take all of those qualitative findings and operationalize them in surveys so that I could try to measure technology maintenance using what I've now narrowed down to kind of 3 key questions, 2 related to technology quality and 1 related to frequency of breakdown. And then validating the kind of negative effects, right, in these quantitative contexts. First, for me, it was by starting with a non-representative sample, 1 a large student sample and 1 an HIV sample, and then kind of recognizing, okay, I've now got this correlational data, qualitative and quantitative. How do I then fill in that methodological gap of needing to kind of test for causality? So it was very, in this particular body of work, very systematic, given how theory gets built, right? And in fact, knowing that I'm probably going to go up for full sometime in the, well, hopefully sometime in the next few years, realizing that I think for me, the next step is to try to say, can I amass this body of work and figure out what needs to be methodologically accomplished before I could potentially kind of propose this construct of technology maintenance as an actual theory? Like, is there a way to try to take the various factors that I see moderating these effects and try to just like present a model that could be kind of tested? So I don't know if that really gets at what your question was, Ednan, but yeah, I'm using the kind of structure of theory building, I guess, as a guide towards
makes a lot of sense.
How you integrate the two, for me, has been really helpful.
Lindsay and Eugene with questions. Lindsay.
Actually, let Eugene go. She had her hand up first.
Thank you. Hi, I really enjoyed your talk, and I was especially really glad to hear that like the poor get richer as possible. And I'm also interested in the social support aspect, and my work actually looks into like how people exchange informational and emotional support on like social media platforms. And it was surprising that in your research, psychological well-being wasn't very wasn't very significant in terms of the results. And I was curious if the qualitative results were also like consistent with the quantitative findings, or if you found that like people were like saying that they also use these technologies to connect with others and also get like emotional support through these technologies.
Yeah, I would have to go back to the specific questions to do like an item analysis to figure out why we don't see those as statistically significant. But the patterns are the same, and absolutely in this data set and in others that I've collected. And as I said, it was, yes, the poor get richer effect was not super surprising to us, based on what I said, this kind of desperate need to have access to these phones to stay connected to people when so few connections are available. You know, Indiana especially is very geographically, I mean, it's people live removed from one another, right? Like people are spread out. and a lot of these people don't have cars though. So getting to have face-to-face interactions with loved ones is not easy. I mean, it's not easy anywhere, but I would argue it was maybe even a bit trickier there than maybe places like California, where people are kind of at least living in more densely populated areas. So yeah, I think that I wouldn't, I mean, it wasn't statistically significant, but it was, the patterns were the same across the board. I don't know, does that answer your question, Eugene? And I can tell you that I find similar things in a lot of my other work as well.
So from the qualitative findings, do you think that people use these technology more for like instrumental uses, or like do they use it more predominantly for like socializing or like the emotional aspects?
Well, if you recall, I actually said that I started this work by doing interviews in public housing when I put people on group texts. So that's actually also a study that's published in JOC. And in that study, we actually content analyzed the texts in the groups. We didn't obviously have access to the face-to-face group communication, so we couldn't compare the content across the groups, but we actually used kind of different social support types as the frame for, at least in those texts. And, you know, consistent with a lot of other work, it's the emotional support that seems to be the most important. Although there was, you know, at least in that particular study, some evidence of things like tangible support, you know, suggesting jobs that people could apply for, or offering to help one another out by bringing food to each other when someone was sick. But yeah, mostly it was cheering one another on, becoming, you know, a kind of emotionally supportive community. That seems to matter most, for sure.
Thank you so much for answering my question.
Lindsay.
Yeah, so thank you, Amy. This was a really great talk and has given me lots to think about with our project. So I'm going to steer you in a slightly towards the work that you didn't necessarily talk about, but you ended kind of with this thought, your thoughts on kind of the implications of what you found with respect to social support moderating, this for those who are kind of already limited in terms of social support, they benefited the most from these technologies. And so, and the implications then for more online kind of social technologies and participation in those communities. But in our work, what I've been thinking a lot about is theorizing what social support looks like when you're talking about a public platform where community, because we offer, so far we're kind of talking about community and kind of connecting in a way where maybe the boundaries are kind of more closed, like it's more closed technologies. But with something like Twitter, where folks may kind of be trying to connect to gain social support and to kind of find and build community, you have other people who are also allowed to participate in that space. And what we're definitely seeing, amongst many other things, is an incredible amount of tensions being expressed. And in part because this is a very intersectional community. And so there are a lot of conversations kind of negotiating racial identity, gender identity, sexual orientation, all kinds of things. But I'm just wondering if this has come up in your own work and how you kind of think about this, because I think it is an open door to kind of re-theorizing what support potentially looks like on these very public facing platforms.
Yeah, actually, I promise I didn't pay Kurt to ask that question, but I actually have data that I'm trying to submit right now, right up, that was a follow-up to the diary data that I presented first that showed kind of how, the internet can be used strategically to build networks. And so I went in and did interviews in pairs of teams. So one white passing, and myself included, and then one Black interviewer interviewed low and high income whites and people of color, mostly African Americans and some Latinos, and actually asked them, how do you use the internet for network building? Like, how do you strategically, basically tried to get a qualitative interpretation of this social diversification idea. And so just talk to people about it. And actually in that work, what the kind of punchline of that study, which I'm happy to share with you again, I'm hoping to send it out in the next few weeks. So it's certainly not published. It's not even under review yet, but the punchline is kind of drawing on a lot of sociological work on lack of trust in low-income communities and communities of color as a real stumbling block towards social capital building. And most of that work has been done a lot by, her first name is escaping me, Smith is her last name. And she's she's a sociologist at Harvard now, and she was at Berkeley, who's done a lot of work on looking at kind of network building or networking as a means for economic mobility and employment mobility in the Black community specifically, and found that you don't see like African Americans kind of leveraging their networks in the same way because of largely this lack of distrust, or its lack of trust, excuse me. And so, yeah, I mean, that is what we're actually saying in this, from a theoretical perspective in this paper, is that the social diversification hypothesis needs to be moderated to account for trust and access to technology, because how can you strategize if you don't actually have access to the stuff either? So that was a big point. But yeah, I mean, I'm also finding that in other research that I'm working on with low-income communities of color, that, right, you've got that tension between wanting to encourage people to get online, to leverage these spaces that where maybe if they can find community, they may feel safer, but there's also a huge, lack of trust, and probably for very good reason, not just because of kind of historic mistreatment or exploitation by communities of color, but also because the internet can be really a really terrible place. and
yeah, I mean,
happen. So
it's the toxicity of it all. I mean, I find like, and part of this is just my own awakening in terms of perhaps my naive assumptions at first about what this was all about. And now that we're kind of digging much more deeply into the discursive data, like understanding that this is, at first we kind of were like, okay, this is maybe one part social support and community building, one part kind of activism space, right? And then, but it is much more complicated than that. And it is, I think trust is actually a really important concept. And then I feel like threat is another, because of these open boundaries, like in efforts but to find community, at least within this particular demographic community, this very intersectional demographic community, I feel like there are constant threats to that process, because other people are able to kind of come into this space and challenge their identities, challenge who they are, and challenge what they're trying to do. And that's obviously disheartening and sad, but I'm trying to kind of lean into it and kind of think more carefully about that, about what that means. But anyway, thank you. I appreciate their thoughts on that.
I'm happy to keep talking with you about that also, Lindsay.
Yeah, sure.
I think that I've thought about this for a while too, that there's ways to think about, like, even pulling in kind of classic CMC literature on just the ways that the internet, right? Yeah, it kind of amplifies the intensity of situations for better and for worse. And then I think that intersects with these vulnerable populations in really important and kind of systematic ways. So yeah, I would agree with you basically.
Awesome.
We are almost out of time. I mean, we've a bit over our 1 hour mark, but if anybody has one more question, I don't know if you have to jump off quickly.
Oh, I'm okay, actually.
One more question, if there is one. Okay.
Just a quick one. So the emphasis of your work on health is also interesting and resonates with some of the work we've done with homeless folks. For example, in one of our surveys, when we asked what do you do most when you connect to the internet, the top answer was health, was information about health. I think we didn't follow up, but they didn't mean health, mental health through social connection. They meant, looking for how do I treat these scabs, or some information that was much more instrumental. I'm wondering whether you found that as well, that in addition to getting better health through connections, people also get it through access to services that are more inaccessible.
Yeah, 100%. And again, so that was the first study that I did where I explicitly kind of attacked this idea of technology maintenance. It was with a HIV positive population, and really wanted to hear their experience of how cell phone disruption disrupted access to healthcare. And kind of the short story is, perhaps not surprisingly, maybe what you find is when we talked about kind of the idea that maybe not having a phone on would disrupt urgent healthcare, no one seemed super concerned. It was like, if I'm having a heart attack, I can find a phone if I need one, right? It was more this like slow degradation of healthcare delivery that was the problem, right? So people would say things like, yeah, if I call my nurse and I get stuck on the phone on hold, which is common when you call the doctor's office, right? That'll eat up my minutes. And so I can't do that. So I won't call if I'm low on minutes. Or yeah, I lose touch with my caseworker by the end of the month. What we did is also we actually talked to caseworkers as well and their experience, like kind of, so the whole experience of cell phone disruption from their perspective. And they would talk about the fact that they would sometimes violate kind of the IU Health Center policy and use social media as a way to connect, because sometimes if people were out of voice minutes, but they would still find free Wi-Fi, then they could still use their social media to connect with, so they would reach out to their patient, say, you've got to come in and pick up new meds. And sometimes, Facebook was the only way to communicate with them. So yeah, I mean, I could go on, but yeah, there was a variety of ways that I think, and this is another place where I feel like this has been hard to value, because I do think that you couldn't point to, again, like a specific death rate and say like, because of lack of cell phone service, people aren't getting X urgent service. It was more just, you're slowing down, at least in my experience, what I found is you were slowing down an already slow, cumbersome body or, service. And it just made it, healthcare delivery even worse.
Mm-hmm.
For sure. People not getting tests they needed in time, things like that. Yeah. Happy to talk more with you about it. I actually am kind of healthcare because the poor are the sickest in this country, and the poor are those who are least likely to have access to technology. And because, like you just said, Francois, like one of the primary uses of this stuff is for healthcare information, like communication. Health is like one of the primary reasons we use the internet. And so that kind of trifecta to me continues to make health a really important outcome to focus on. So happy to keep talking about it.
Thank you, Amy. And of course, that was most of it pre-COVID. You can only imagine what that means post-COVID with vaccination, testing, everything being online for scheduling and etc. So, well, thank you. I don't want to keep you more. This was fascinating. Of course, you will still contribute to our thinking and through your participation in the board of experts. But hopefully, we'll have you back to talk to some of your new research as it comes out. Thank you so much. And just a quick announcement, we may have our first in-person meeting next week, next Friday. We're trying to get everybody's approval. It seems like this has to go through almost to the president of the university, but we're trying to make it happen. So be on the lookout, but we may actually get together in person next Friday for one of our seminars. But again, thank you, Amy. And of course, hopefully you'll be able to just, make a quick trip to LA and come visit us in the not so distant future.
That'd be lovely. But feel free to email me if anyone has any follow-up questions. So thanks again for the opportunity. It was really nice to talk to all of you. Bye, everyone.
Thank you.
Bye-bye. Thank you.
Take care.
Take care.